Hello, my name is Rebecca. Welcome to our East Kent Hospital University Foundation Trust pre- and postnatal Pilates class. This class is designed to help support you during and following your pregnancy and focuses on Pilates-based strengthening exercises. All exercises are suitable for any stage during your pregnancy or a few weeks postpartum, provided a healthcare professional hasn't advised you otherwise. All the exercises should be comfortable to do. We're going to start the class with a warm-up in standing, to progress to some mat-based exercises and then cool down with some gym ball exercises and finally a relaxation session. All you need for the main section of the class is a mat or a bed if that's more comfortable, loose comfortable clothing and a couple of pillows as well. If you have a gym ball to sit on, I'll teach you some great exercises to try, but these can also be done sitting on a chair. If at any point the exercises become too much, just take a little break and then re-begin with the next exercise. Please don't push into pain and remember to let your physiotherapist know how you get on. The exercises in standing can also be done at a chair if you're struggling with pelvic girdle pain, that's okay. Now we're ready, let's begin, so come and stand on your mat. Okay, let's begin. So I'm going to start with getting you into a neutral position in standing. So if you bring your toes apart into a V, heels so they're in line with that, soften from the knees slightly. Now if you imagine your pelvis is like a bowl of water, you're going to tip that bowl forwards to splash some water out of the front of the bowl and backwards. So finding that range through the pelvis, tucking the tailbone under and then arching the back, feeling that stretch there through the lower back. And then gradually making those movements slightly smaller and coming and resting in a middle position, so quite flat through the front and the back. And in this position at your pelvis, this is where it's easiest to engage your core and switch on those pelvic floor muscles. You're going to make sure our ribs stay nice and flat, tummy muscles engaged. Relax your arms down by your side and I want you to imagine your shoulder blades and let them sink down low to the floor. Collarbones wide, you want your neck with a little chin tuck, so as though you've got a peach just tucked under your chin, and head nice and high like a helium balloon. This is your neutral position. It's lovely to try and find this position day to day when you're doing different activities, especially if you're pregnant, as this will be a change of your centre of gravity in your posture. In this nice neutral position, it's easy to engage our core and our pelvic floor. I'm going to talk you through a little bit more of that now, so I'm going to explain a bit more about your pelvic floor muscles. So this is our pelvis. Your pelvic floor is the muscles that sit within the pelvis and stop you going to the toilet. On your pelvis, this is your pubic bone, you've got your tailbone at the back and then your two sit bones either side. Your pelvic floor muscles attaches to those four bony landmarks. So if you imagine it's like a handkerchief spread out across those bony landmarks. When we engage those pelvic floor muscles, we want to close through the front, as though we're stopping a flow of urine, close from the back passage, squeeze those four bony landmarks together and then lift up as though we were lifting the centre of that handkerchief up through inside us, so lifting through there. These muscles obviously have lots of extra stress and strain during pregnancy, so it's a really good idea to be working them now and practice these types of exercises all the way through your pregnancy and then once you've had the baby now, just to avoid any extra complications. So I'm going to talk to you a little bit about how to switch these muscles on and what that should feel like for you. It's the same muscles that would stop you going to the toilet. So when you're ready, if you close through the front as though you're stopping a flow of urine, draw in through the back passage, and then as though you're picking up that handkerchief, lift up through those pelvic floor muscles. You should feel a little lift as those muscles engage and switch on. You might find it's difficult to start with, but hopefully as you get practicing, that will get slightly easier. These pelvic floor muscles work alongside our trans-abdominal muscles, our lower abdominal muscles. So we also want to be working them at the same time. So if you feel the bony points of your pelvis and then come slightly forwards, to switch on our trans-abdominal muscles, we want to imagine we're wearing a slight corset and are just drawing in through there. So hopefully you can feel some slight tension under your fingers. Or if you are pregnant, if you think about hugging your baby in towards you or drawing your belly button into the spine. We're going to try and work both of these muscles together at the same time. So you're thinking about lifting through the pelvic floor and engaging those trans-abdominal muscles. And as we do this, we're going to lift our arms to work on our strength and endurance of these muscles. So whenever you're ready, breathe in to prepare, and then as we slowly lift our arms, I want you to lift through that pelvic floor and engage those trans-abdominal muscles. Keep them switched on, breathing at the same time, and lower back down. We're going to do another two sets of those, so with a long, slow contraction to work our endurance. So breathe in to prepare, and then keeping breathing, lifting through that pelvic floor, so drawing those 4 bony landmarks together to keep our pelvic floor muscles engaged, feeling that tension across our lower tummy as well, and maintaining that contraction as we slowly lift our arms up and down. Lovely, well done. Another one of those, nice and slowly. So thinking about that lifting and drawing in across the tummy, holding that contraction. Lovely. And maintaining that contraction all the way through, getting those muscles switching on really nicely. Lovely. We'll do a little bit more of that during the class, so we'll practice it in different positions, and the more you can be doing that day to day, the better. So you can be practicing it when you're sitting, when you're walking, when you're doing all sorts of things day to day. We work these muscles to work their endurance. We also want to work our fast twitch muscle fibers, so practicing switching the muscles on and off quickly. So for this, I want you to think about lifting quickly and then focus on the fully relaxing and letting go of those muscles. So when you're ready, we're just going to switch on and switch off. On, off, on, off, on, off, on, off, on, off, and one more, on, off. Lovely, okay. So hopefully you've got the hang of that slightly. We'll practice it more during the class, and it should get easier the more you get used to doing it. We're going to start with some exercises to get your bodies warmed up, and I'll talk you through when we want you to be working your pelvic floor muscles as well. We're going to start with our corkscrew exercise. So if you float your arms round up towards your ears, shrug the shoulders as high as you can, and then lower the shoulders all the way back down and relax. Same again. So I want you to think about all those muscles around the shoulder blades, switching on and then relaxing down fully. Lovely. Couple more like this. Great. So waking up all those muscles around the shoulders. Okay, and then we're going to add in some rotation in this position to get a bit of a stretch through the spine. So floating our arms into that position. I want you to keep your hips pointing forwards and rotate as far as you can one way, back to the center, and same to the opposite side. So this should be a nice, comfortable stretching feeling through the spine. Go as far as feels comfortable for you, making sure that those hip bones are pointing forwards so we're not rotating the whole body. We're just getting that twist through the spine. Lovely, and one more on either side. Lovely. Lower the arms back down. We're now going to add into it in a heel raise to that exercise, so getting your core muscles engaged. And what I want you to think about is as we rise up onto your toes, I want you to lift that handkerchief, so lift up through the pelvic floor and hold the contraction whilst we do the shoulder stretch. So when you're ready, rising and lifting through that pelvic floor, holding that contraction while we rise our shoulders up towards our ears, lower back down and relax. Same again, so really lifting through that pelvic floor, maintaining that contraction, and then relaxing back down. Lovely, so you might feel that this is a little bit harder to do now than when we did this exercise just in standing, keeping those pelvic floor muscles switched on. Great, one more of those. Brilliant, good work. Okay, we're going to do a bit of a side stretch now. So if you bring one shoulder all the way around up towards your ears, and then carry sliding that hand along down towards your ears and stretch through the side of your body. And back to the center and opposite side. Rolling that shoulder as big as we can and reaching across. So feel that opening through the ribs of the opposite side. Lovely, you want to make sure that you're not leaning forwards or backwards, so we're not twisting one way or the other, we're staying nice and steady in the middle. Brilliant, and this should be a comfortable stretching feeling as we open up through the ribs of the opposite side. Lovely, one more either side, see if you can go a little bit further this time. Lovely, great. Okay, we're going to do another twisting exercise in this position. So if you float your arms up in front of you like you're holding a beach ball, and we're going to do an exercise called thread the needle in standing, which we'll then do in a kneeling position later on in the class. So for this exercise, if you take one hand and reach across to the opposite side of the body to get that stretch through the back, and then come back to the centre as though you're holding the beach ball. And same in the other direction. So following that hand with your gaze, so that you get that stretching feeling all the way through the spine. Lovely, again, go as far as feels comfortable for you. We're aiming for these to be twisting, stretching exercises, and they shouldn't be painful. One more either side. Lovely, and then relax back down. Okay, now that we've got some mobility through the spine, we're going to start working the legs a little bit more. Okay, so to warm up the legs a little bit more, if you place your hands onto the bony points of your pelvis, make sure you're still in that neutral position, so your feet are shoulders distance apart, knees are nice and softened, shoulders relaxed away from your ear, and your head's floated up like a helium balloon. We want your hips to stay nice and level, but we're going to do our hip twist exercise, so working on the movement through our hips. If you come up onto your toes on one side, you're going to just let the knee fall out to the side, back to the centre, and lower back down. And then do the same on the other side. So for this exercise, we're working on our stability of the leg that we're not moving, keeping our core muscles engaged so that we stay nice and level through the pelvis. Lovely, and aiming for these to be smooth, controlled movements from one side to the other. Try and make sure you're not holding your breath. You've still got that little peach shape tucked under your chin, so a slight chin tuck there. Lovely, and you want the movement to be slow and controlled all the way through. One more on either side. Lovely, and then relax back down. Okay, we're going to move on to doing a marching exercise, so this is slightly harder. If you're struggling with pelvic girdle pain and that hip twist was enough for you, keep going at that level. If you want a bit more of a challenge, you're going to float that leg up into your tabletop position in standing and lower back down. So just working on transferring the weight from side to side. Again, trying to make sure that our hands stay nice and level so that while we're transferring the load, we're not twisting and rocking all over the place. Lovely, shoulders relaxed, still breathing at the same time, core muscles engaged. We're just aware of our lower tummy muscles switched on. Lovely, and all these exercises we want to be nice and slow and controlled movements all the way through. We're working on our stability. Brilliant. Which is really important during pregnancy as well, because obviously you've got your changes in your centre of gravity. That can affect your posture. We want to work on our stability and our balance for all the day-to-day things that we're doing. Lovely, one more on either side. And lower back down. Okay, we're going to move on to some squats in standing now. So if you bring your toes slightly further apart and feet slightly wider than hip distance apart now. As we do our squat, I want you to think about lifting that handkerchief, so drawing up through those pelvic floor muscles as we come down into our squatting position. If you're suffering from pelvic girdle pain and this is a bit too uncomfortable for you, either make the movement smaller, or you can do your squat standing against a wall so that you've got the wall to help support you as you do the movement. So we're just going to float our arms forwards as we squat down and lift through that pelvic floor. Lovely, go as far as feels comfortable for you. Trying to make sure that our knees come out over our toes, so there's no knocking our knees in at all. We keep our knees nice and wide and controlled. Lovely. Still making sure that we're not holding our breath at all. Nice and wide across the collarbone. Good work, well done. And each time thinking about lifting through that handkerchief, engaging that pelvic floor as we come down. Lovely, one more like that. Okay, and then we're going to add in a little hold. So we're going to come into our squat with that pelvic floor lift and see if we can stay there 5 seconds. So breathing in to prepare, and then as you breathe out, lifting through that pelvic floor and holding there. Maintaining that contraction, hopefully feeling those thigh muscles a little bit warmer. Lovely, and rise. We're just going to do a couple more of those. So breathing in to prepare, and then as you exhale, lifting the pelvic floor, coming down into your squat, holding for 5, 3, 2, 1, and come back up. And one more of those. So breathe in to prepare, exhale, lifting, 5, 4, 3, 2, 1. Lovely, and relax. Okay, those are our exercises in standing, so we're now going to move on to the kneeling part of the class. Okay, so we're now going to move on to doing some exercises into a kneeling position. So if you come down so that you're kneeling on your mat, so when you're kneeling, I want to make sure that your hands are directly under your shoulders, knees are in line with your hips, about shoulders distance apart again, feet nice and relaxed. The things to think about here is making sure that we're nice and lengthened through the spine so that we're not dropping down through the neck at all. And we've got strength through the shoulder girdle, so we're pushing away through our hands away from the floor. Feet are nice and relaxed in this position. We're going to start with our cat-cow exercise, so getting a bit of movement through that pelvis. So if you drop your belly button down towards the floor and lift the head away, you should feel that stretch through the spine, and then arch your back, tucking your tailbone under and tucking your chin towards your neck. Keep going with that movement, finding your range here, so finding wherever's comfortable for you. Brilliant. Lovely, and enjoying that stretch through the spine. One more of these, see if you can go a little bit further this time. Lovely, and then come into your neutral position, so making sure that you're nice and flat through the back. From here, we're going to work our pelvic floor muscles against gravity. I'm going to add in a heel squeeze. So if you bring your heels so that they're together, that's going to help wake up the leg muscles as well, and those inner thigh muscles that are connected onto those sit bones, the same as your pelvic floor. So from here, working against gravity, I want you to think about that lifting up through that handkerchief and holding as you squeeze your heels together for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then fully relax. And we're going to do another 2 sets of those. So bringing your heels together, engaging those leg muscles, thinking about lifting that handkerchief, so stopping that flow of urine, so stopping the flow from the front, squeezing through the back passage, lifting that handkerchief and holding that muscle contraction while still breathing at the same time. Lovely, fully relax, and then one more set of those. So bringing your heels together, adding the squeeze, closing from the front and the back, and then lifting and holding that position against gravity for 10 seconds while still breathing and holding that nice neutral spine position. Lovely, and then relax. Okay, we're going to move on to another stretching exercise in this position. So this is our thread the needle exercise, which is similar to the one that we did in the warm-up, but we're now doing it in kneeling. So if you reach one arm away from you, nice and wide, and then tuck that hand under the opposite side, following it with your gaze to get a twist through the spine. And back to neutral, and same on the other side, so lengthening away and twist. Lovely, trying to make sure that you stay nice and square at the pelvis, but getting that stretch through the spine. Lovely, feeling the opening through the chest as you lengthen away, and then stretching as you come back down. Lovely, one more like this on either side, lengthen away and twist. Brilliant. Lovely, so stick it like that if that's enough for you, or if you want a bit more of a challenge, you can bend that opposite arm and really stretch through so that you're resting your hand onto the ground. So we'll do a couple more with a bit more of a stretch. So lengthening the arm away, I want you to really reach and bend the opposite elbow, resting that hand on the ground to get more of a stretch. Lengthening And then bending the opposite elbow, following it with your gaze. And feel that stretch through the spine. Lovely, one more on either side. See if you can go a little bit further this time. Trying to stay neutral through your pelvis, not holding your breath at all. And feeling that stretch through the back. Lovely, good work. Okay, we're going to move on to an exercise working a bit more on our stability through the shoulder girdle to start with. So I want you to come back and check that you're in that neutral position. So head and neck nice and long, pushing the floor away from you so your chest bone's lifted high and not too arched or flattened through the back in that middle position. We're just going to lengthen one arm away from us, nice and long, and lower back down. And alternate to do the same on the other side. Lovely, so this is working your stability through the arm that's staying put. And I want you to think about a sense of length as you reach away with the opposite hand. Core muscles still engaged, so you're still aware of those lower tummy muscles switched on. Lovely, not holding your breath at all. Lovely. One more on either side. Brilliant, okay. If your wrists or your hands are getting tired in this position, you can always move on to a fist or change the position of your hands to make it more comfortable for you. We're now going to add in the leg movement. So making sure that your pelvis stays nice and square, you're going to transfer your weight over to one side and slide the opposite leg away from you nice and long. And back to neutral. The same on the other side. Keep going, one side and the other. Still thinking about those watch points, so making sure that you're not dropping down through your head and neck at all. You're still pushing that floor away from you. Core muscles engaged. Lovely, and the movements are slow and controlled all the way through. Think about squeezing through those glute muscles as you lengthen the leg away. Brilliant, couple more on either side. Keeping that movement slow and controlled. Hugging that baby in towards you if you're pregnant or aware of your lower tummy muscles. Okay, we're now going to have a bit of a stretch here before we move on to the higher level of that exercise. So if you bring your knees slightly further apart and drop your bottom back. Now if you're pregnant, you may only be able to go so far with that exercise, just go to where you can feel stretch. If you're postpartum, you can reach forwards with your hands and enjoy that stretch there through the back. Take a breath in and then slowly breathe back out. Lovely, and then come back into our 4-point kneeling position. We're going to move on to the higher level of that exercise, so combining those two movements. If this is too much for you, feel free to just go back to lifting one arm on the opposite side. If you're staying with me, as you lengthen one arm away, you're going to lengthen the leg out the opposite way, trying to make sure that you stay nice and square through that pelvis. Really thinking about the sense of length as you reach the opposite leg from the hand that you're lengthening away. Lovely, thinking about those watch points, so making sure that you haven't dropped through the neck at all. The shoulders are away from the ears, so they've not crept up towards your ears like you were shrugging. Chest bone is lifted away from the floor. And pelvis is in that neutral position, so not twisting or rocking from side to side, staying nice and square. Good work, couple more here. Lovely, one more on either side. See if you can reach a little bit further and add in a slight hold. And the opposite side. Lovely. Okay, we're going to finish off with a stretch in this kneeling position. So again, bringing the knees slightly further apart, Drop down as far as you comfortably can. If you reach with your left hand all the way over to the side and bring that right hand on top, drop down through that right glute into your opposite heel and feel that opening along the side of your body. Lovely, and then come around the opposite way. So bring your right hand over to the opposite side, left hand reaches on top, dropping down through that left bottom muscle towards the heel and feeling that stretch through the side. Okay, we're now going to come and do some exercises in a side lying position. So on your mat, if you use a pillow under your head and come and have a lie on your side. If you're suffering from pelvic girdle pain, you might want to pop a pillow in between your knees for these exercises, and rather than doing the full movement, we'll just do smaller movements through the hip joints. So when we're in our side lying position, you want to make sure that your feet are in line with your bottom. You've got a small bend in the knees, about 30 degrees. Your hips are stacked one on top of the other. Top hip tilted quite far forward, so making sure that we're not rolling backwards at all. You want a small gap in between your waist and the bed or the floor, wherever you're lying. So if you lengthen that top hip away, you should just about be able to fit a piece of paper or your hands underneath your waist and the floor. Neck and shoulders relax, so we're not shrugged up here, but our shoulders are nice and long, away from our ears. And arms, however's comfortable for you. You can rest your hand in front if you want, but making sure that you're not gripping through the floor, so you're using your core muscles more for your stability. We're going to do some strengthening exercises here to work our glutes muscles, which are big, powerful hip muscles, really important for our stability and great to be working during pregnancy. If we can get these muscles nice and strong and firing really well, it can alleviate some of the back pain that you may be getting or any strain that you've got going through your back. So that's why we're doing all these exercises. So starting with our clam level 1, you're just going to lift the top knee just to slightly higher than hip height and lower back down. And keep going with that exercise, making sure that you're not rolling backwards at all. If you've got pelvic girdle pain and you've got the pillow in between your knees, you might just be lifting, so you're taking the weight off it and then squeezing the knees together back down into it. So you're just lifting and taking the weight and squeezing back down. If this exercise is feeling comfortable for you, you can carry on with your clam level 1. This is a muscle strengthening exercise, so hopefully after we've done a few, you'll get that slight muscle achy feeling through where your back pocket would be, where you're wearing trousers. If you're not feeling it here, or you're feeling it further down in your legs, tilt that top hip further forwards and think about squeezing your sitting bones together. Lovely, still making sure that you're not holding your breath, shoulders lengthened away from the ears. 2 more here. Well done, good work. Okay, we're going to go straight from there into our side kick exercise. Again, another strengthening exercise for those big, powerful glute muscles. So if you float your knees and foot up, imagine that you had a coffee table in front of you and you're polishing that coffee table with your legs. So keeping your foot and knee in line, slide that leg forwards and backwards. The key thing here is making sure that you don't bring that leg back behind you. You're just going back to neutral each time and keeping that movement smooth and controlled. Hopefully you can feel the big powerful glute muscles starting to work now. That uncomfortable muscle burn feeling is what we want to be feeling for this exercise. Still making sure you're breathing, not pushing down with your waist into the bed. Core muscles engaged. Lovely, 3 more of those, trying to keep the movement nice and smooth and controlled, not too wobbly as we go. Well done, good. And then relax that leg back down. Give it a rub if you need to. And then for one last challenge, we're going to combine those 2 exercises. If this is too much for you, again, or you're struggling with your pelvic girdle pain, keep that pillow in between your knees and keep going with just small squeezes and lifting. If you're staying with me, we're going to combine those. So lifting the top knee, bringing the foot up to join it, gliding forwards, polishing that coffee table, back behind, feet together and knees together. We're going to keep going for 10 repetitions of these if we can. Hopefully we'll really get that muscle burn through our big powerful glutes muscles, which is going to give us all the stability around the hips that we need during our pregnancy and after we've had the baby as well. Still making sure that you're not holding your breath at all. Shoulders and neck nice and relaxed. Not pushing down with the waist into the bed at all, or the floor. And keeping that movement smooth and controlled. Good work, well done. Just a few more repetitions here. Lovely. If we can get these muscles firing really nicely, it will help you with your walking, all the day-to-day things that you do. Keeping everything strong. Last one. Well done. Good work. Give it a rub if you need to. We're then going to start to work our inner thigh muscles. So if you relax that top leg in front of you on the bed or the floor and lengthen out the bottom leg so that that bottom knee is nice and straight. Draw your toes up towards you and make sure that knee stays straight. We're going to work our inner thigh muscles now. So you're just going to lift up with that foot off the floor and then lower back down. Making sure that you're not pushing down with your waist into the floor at all. Lovely, you won't have loads of movement here, that's absolutely fine. We're thinking about squeezing through those inner thigh muscles to lift that leg. And these inner thigh muscles also connect onto the same place as your pelvic floor muscles, so we want to get them nice and strong to control all your movements. Good work, a few more here. Lovely, and then we're just going to finish off with pulsing, so holding that position. So if you float that leg up, make sure that knee's straight and just pulse up and down for 5, 4, 3, 2, 1. And relax that leg back down. Well done. That's the last of our strengthening exercises in this position. We're now going to add in a bit of a stretch. So if you lengthen one arm away from you, reach the top hand on top. This is an exercise to get a bit more mobility through the spine and the upper back. So if you reach forwards with the top hand, lift that hand up towards the ceiling, drop down through that chest bone to get a stretch through the spine and reach behind, back towards the ceiling and all the way back over. Same movement again, so this is our arm opening exercise. So getting that stretch through the chest. Lovely, keeping those hips stacked one on top of the other, but getting that movement through the upper spine. This is a lovely exercise to do, particularly postpartum. If you've been spending lots of time feeding the baby, maybe in not the best posture, this is a nice exercise to get some opening across through the chest. It should be a comfortable stretching feeling. And if you follow your hand with your gaze, you'll get that stretch all the way through the spine. Lovely, one more of those. See if you can go a little bit further this time. Brilliant, well done. Okay, we're just going to come up into side sitting here and do some stretches. So if you tuck your legs in front of each other and reach out in front over to the opposite side, enjoy that opening stretch through the side of the body. And then lower that top elbow down towards the mat and stretch out long there. Enjoying that comfortable stretching feeling. Okay, we're now going to move to do those exercises in side lying on the opposite side. Okay, so in our side lying exercises on the other side, we're making sure that our feet are in line with our bottom, knees have a small bend, top hip tilted forwards, not rolling backwards at all, shoulders stacked one on top of the other, maybe hands in front of us just for some support or onto the pelvis. You want a small gap in between your waist and the floor or the bed so you're not pushing down through there at all. Core muscles still engaged, neck and shoulders relaxed. Starting with our clown level 1, so just lifting the top knee and then lowering back down. Again, a strengthening exercise, so thinking about squeezing those sitting bones together as we lift that knee, getting those powerful hip muscles working for our stability. And if this is uncomfortable for you, if you're suffering with pelvic girdle pain, you've got that pillow in between your knees and you're just lifting away from the pillow and then squeezing back down into the pillow. So all these exercises should be comfortable for you to do. Keeping the movement controlled. Hopefully you can start to feel a little bit of a muscle ache around where your back pocket would be if you were wearing trousers with a back pocket. Couple more here. making sure we're not rolling back through that top hip. That top hip needs to stay really far forwards. Lovely, and then we're going to go straight into our side kick exercise. So floating the knee and the foot up off the bottom leg, gliding forwards and back to neutral, as though we're polishing that coffee table with that leg. So keeping everything in line as we bring that leg forwards and backwards. Relax through the shoulders, core muscles engaged, still that sense of space in between your waist and the floor. Hopefully you can feel a little bit of a muscle burn through that glutes muscle. That means that we're doing these exercises right. Good work, keep going. Lovely, a few more to go. Still making sure you're breathing, not holding your breath at all, even while you're concentrating. Last one like this. Brilliant, relax that leg down, back on top of the other. Give that glutes muscle a rub if you need to. And then we're going to go into that final set, which is the level up of these exercises, combining those two movements. So coming into your clown position, lifting the foot up to join it, gliding forwards, slow and controlled, back to neutral, and lowering back down. 10 of these here for us. Slow and controlled. Smooth movements, not speeding up as we go. Lovely. Feeling that muscle burn, getting those big, powerful hip stabilizing muscles nice and strong to help support us all the way through pregnancy and after we've had our baby as well. Lovely. If you need a break anytime, feel free to just have one. If not, keep going with me. Good work, 4 more to go. Still making sure that the neck and shoulders are relaxed. We're not holding our breath at all. Aware of our lower tummy muscles switched on. Last 2. Brilliant. Keeping it controlled. Lovely. Give that muscle a rub if you need to. We're now going to work our inner thigh muscles. So let that top leg drop down in front of you. If this is an uncomfortable position for you because of pelvic girdle pain or just because your bump gets in the way a little bit, prop a couple of pillows underneath that front leg so that it's supported. Straightening out the bottom leg, toes up towards you, making sure that bottom knee's nice and straight. We're just going to lift and lower, squeezing through those inner thigh muscles. So switching on those hip abductor muscles to lift up and lower back down. We won't have loads of movement there, that's fine, but just getting those muscles working nice and strong. Making sure that you're not pushing down through your waist into the bed or floor at all. Lovely. Couple more here. Brilliant, and then ending with that static hold, so making sure that knee stays straight, lifting the leg and pulsing up and down for 5, 4, 3, 2, 1, and then relax that leg. Okay, finishing off with our arm opening exercise on this side, so knees bent again, stretching our arms out in front of us, reaching forwards with that top arm and then bringing it up towards the ceiling. Then dropping down through that chest bone to get the twist through the spine. Feeling a comfortable stretch, back towards the ceiling and all the way back down. Keep going with these. That sense of opening up wide through the chest and enjoying the stretch there. Following your hand with your gaze so you get the rotation all the way through the spine. Lovely, making sure your breathing's nice and smooth. Watching that your shoulder doesn't creep up towards your ear, so you're still keeping those shoulders down, away from your head. Couple more. Lovely, last one, see if you can go a little bit further this time. Really enjoying that stretch there. Lovely. And then coming into that side sitting position, so tucking our legs next to each other, reaching over for the stretch, feeling that opening all the way through the ribs, and then coming to rest that top elbow onto the floor and stretching the opposite direction. Lovely, and back into sitting. Okay. Okay, we're just going to use our gym ball now to do some exercises. So if you pop your hands onto the bony points of your pelvis, we're going to draw some nice big circles with your pelvis. So tucking that tailbone all the way under, out to the side, and drawing those circles with your ball. This should be a comfortable stretching feeling through your spine. If you're struggling with pelvic girdle pain and this is feeling a bit uncomfortable for you, keep these circles nice and small to start with, and then you can gradually make them bigger as you go. Lovely, and then change direction. Brilliant, so going as far as is comfortable for you, getting that movement through the pelvis and through the lower back as well. Lovely, and then coming and sitting in your neutral position, making sure your feet are hip distance apart again, not too arched or flattened, nice and in that middle position, shoulders relaxed. Okay, we're going to use the ball for a bit of rotation now. So if you pop your hands into a prayer position, put them on the bony part of your chest. I want you to keep your hips pointing forward. See if you can rotate round to one side, back to the center, and rotate to the opposite side. So trying to keep your nose in line with your hands all the time. This should be a comfortable stretching feeling through the upper back. Lovely, go as far as you comfortably can. Core muscles engaged whilst we're sitting on the ball to stay nice and balanced. Lovely, one more either side, see if you can go a little bit further. Great, and back to neutral. Okay, we're going to do some heel raises with arm lifts now. So again, engaging through those core muscles, sense of lifting through that pelvic floor. You're going to lift up one heel and rise the opposite arm, and then swap round to the other side. So this exercise is meant to mimic walking, and you're practicing keeping that stability through the trunk whilst moving your arms and legs at the same time. Watching that you're not flaring through the ribs as you lift the arms, so your core muscles are staying engaged, nice and flat through the trunk. Lovely, one more on either side. And relax back down. Okay, I'm now going to show you a couple of stretches that you can also do using your gym ball, if you've got one at home. So you can also use the gym ball in a kneeling position, resting your hands in front of the ball. If you've got the bump, just make space for your bump in the gym ball. If not, you can be leaning right on the gym ball and stretching forward to get that stretch through the back. You can add in some rotation from side to side and drop down through your bottom muscles. Lovely, and you can also do a stretch to the side with your ball next to you, so reaching over and then alternating to the other side and stretching over with your gym ball. Lovely, okay, that's the main bit of the class finished now, so we're going to end the class with a bit of a relaxation session. Okay, now let's take a moment to check in with how our body feels and be present in this moment. Give yourselves praise for what you have begun and achieved today, and take some time to just relax. We're going to spend a few moments working on a technique called progressive relaxation. Progressive muscle relaxation is an exercise that relaxes your mind and body by progressively tensing and then relaxing muscle groups throughout your entire body. You'll tense each muscle group vigorously, but without straining, and then suddenly release the tension and feel the muscle relax. You'll tense each muscle for about 5 seconds, and if you have any pain or discomfort, just feel free to leave out that step. Throughout this exercise, you can visualize the muscles tensing and a wave of relaxation flowing over them as you release that tension. It's really important that you keep breathing all the way through the exercises. Now let's begin. Begin by finding a comfortable position, either in sitting like I am or lying down in a location where you'll not be interrupted. If you're during your 2nd or 3rd trimester in your pregnancy, we recommend side lying, or if you do want to lie on your back, use a couple of pillows to prop your body up so that you're lifted above a 30-degree angle. Allow your attention to focus only on your body. If you begin to notice your mind wandering, bring it back to the muscle that you're working on. Take a deep breath through your abdomen and hold, and exhale slowly. Again, as you breathe, notice your stomach rising and your lungs filling with air. As you exhale, imagine the tension in your body being released and flowing out of your body. Again, inhale and exhale. Feel your body already relaxing. As we go through each step, remember to keep breathing. Let's begin. Tighten the muscles in your forehead by raising your eyebrows as high as you can. Hold, and then abruptly release that feeling and feel the tension falling away. Now smile widely, feeling your mouth and cheeks tense. Hold, and then release, appreciating the softness in your face. Next, tighten your eye muscles by squinting your eyelids tightly shut. Hold, and then release. Gently pull your head back as if looking at the ceiling. Hold, and then release. Feel the tension melting away. Now feel the weight of your relaxed head and neck sink. Breathe in and out. In and out. Let go of all the stress. Breathe in and out. Now, tightly but without straining, clench your fists and hold this position until I say stop. Hold and relax. Now flex your biceps, feel the build-up of tension. You might even visualize that muscle tensing. Hold and then release, enjoying that feeling of limpness. Breathe in and out. Tighten your triceps by extending your arms out and locking your elbows. Hold and then release. Shrug your shoulders up as if they could touch your ears. Hold and then quickly release, feeling their heaviness. Now tense your upper back by pulling your shoulders back, trying to make your shoulder blades touch. Hold it there and then release. Tighten your chest by taking a deep breath in. Hold it there and then slowly blow out all of that tension. Tighten the muscles in your stomach by sucking in and then release. Arch your lower back gently and hold and relax. Feel the limpness in your upper body, letting go of all the tension and stress, and relax. Tighten your buttocks, hold, and then release, imagining your hips feeling loose. Tighten your thighs by pushing your knees back, either pushing into the floor or feeling the muscles tense in whatever position you're in. Hold there, and then release. Now flex your feet, pulling your toes towards you and feeling the tension through the back of your calves. Hold it there, and then relax, feeling the weight of your legs sinking down. Curl your toes under, tensing your feet, and hold it there, and then relax. Now imagine a wave of relaxation slowly spreading out throughout your whole body, beginning at your head and then going all the way down to your feet. Feel the weight of your relaxed body. Breathe in and out. In and out. Now gradually wiggle your fingers and toes and bring your attention back to the room. And we're finishing there. We hope you found this pre and postnatal Pilates class really helpful. Thank you for joining us today.